Drink, Gary. Whether your brains will come down. I can smoke you, boy.
Victor Chinemeriam Aniebu, and I'm popularly known as Victor Top Sales. And I'm here to honor the invitation the SCGPRO gave to me. So stay tuned.
Yeah, you can just tell me if you want you with you. See me got a Louis too. So many other guys want you with you. Now I just want to marry ya. Oh my designer.
Hello, guys. Welcome to our first episode of our tete-a-tete interview. Here in our house, we have our guest speaker in the person of.
Victor Aniebu, popularly known as Victor Talks Health.
Okay, Mr. Victor. Nice to meet you, by the way.
Thank you very much.
Mr. Victor, you're going to give us some intels, as some people may say, on the dangers of Postinor 2.
Okay.
You and I know that Postinor 2 has become the order of the day for some women.
Yeah.
So most people say that there are effects in these things, though it prevents unwanted pregnancy to the best of my knowledge.
Yeah.
So please, what are the dangers involved in taking this Postinor 2, please?
Okay. This Postinor 2 drug, truth be told, it has been abused by a lot of young women, both married women. And the fact there is that most people don't know the effect of this Postinor 2. And I'm here now to make a little enlightenment on it. So this Postinor 2 is actually a 72-hour emergency contraceptive. That is, if you use it above after 72 hours and you use it, it's not gonna work again. You understand? And it is meant for emergency, but people are now using it after every sex. They take Postinor 2, they go raw, they take Postinor 2. Even some people will combine it with Ampiclos Bicham. People are really doing things, and it's very, very bad. They don't know what they are actually doing to themselves. So that Postinor 2 now, it has serious effects, and taking Postinor 2 over time can cause bleeding, it can cause blood spotting, it can cause skipping of your menstrual period. Let's say you're supposed to see your menses on 5th, can shift to the next month, sometimes 10 days ahead and stuff like that. It can actually seize your ovulation. Most times it can come with let's say chronic use of Postinor 2, because there are some people that take it more than twice, 3 times, 4 times. Some people every time they have sex. If you're a type of person that does this kind of acts now, it can lead you to what we call polycystic ovarian syndrome. It can lead you to ovarian cysts. It can also lead you to what we call hormonal imbalance, which is now a process that this one now, you will not be seeing your period, both ovulation, getting pregnant to be very, very hard for you. People don't know this particular thing now. And the people that add ampiclos bicham to their own, saying that it helps prevent infection after having raw sex, that one is the worst one. Because ampiclos bicham, when you are taking ampiclos bicham on every after every sex you have, you're actually abusing antibiotics, and it can lead you to what we call antimicrobial resistance. This is a particular issue whereby you have a particular problem, let's say infection or an issue that antibiotics are meant to tackle. If you take antibiotics, it won't be working for you again. There are some people that will go to test, you will see their list of sensitivities and resistance in drugs. You will see sensitive, resistant. You might just see too sensitive. Sensitive means the drug that will work for them, while resistant are the ones that won't work for them. You understand?
Sorry to cut you short.
Okay.
Sorry to cut you short. So what do you mean? Like, let me say someone is taking this Postinor 2 too much. It means that there is an extent you take Postinor 2 to, your body become resistant to it.
Yes. There is an extent you will take Postinor 2. Like if you take it, it won't work for you again.
Wow.
Thereby, it have damaged you, leading you to these issues, these effects that I explained, and it can also make you not to be reacting to it again. Let's say Postinor 2, you had sex today, you took Postinor 2 today. Yes, it's supposed to work for you, but due to the extent of the abuse on this particular drug, it won't work again. It works pari passu with antibiotics. That's the same way antibiotics work. You understand?
So which means our body gets used to drugs.
Yes, our body gets used to drugs. Yes, it's very, very sensitive, but people don't know.
So if this is the case in Postinor 2, why do pharmacists approve such drug? If this is the case,
Okay, the thing there is that Postinor 2 is not bad to use, but it was tagged an emergency contraceptive. Let's say if you are using Postinor 2 once in a month, it won't really affect you. It's normal. You understand? Let's say when you are to use Postinor 2, maybe you are using a condom and the condom burst. You now uh, get to make things well by using
Okay.
Postinor 2. You understand?
Okay, yeah.
So that's just the thing there.
Okay. Now, if Postinor 2 is actually bad, as you may say, or maybe the overuse of this drug is actually bad, what do you advise people to use if they have sex and then maybe the sperm enters, something like
Okay.
that?
The thing there is that first of all, you should have a trusted partner.
Okay.
You understand? Because most people will tell you they are doing withdrawal method, this and that, but withdrawal method is a scam. Some people they are there's this funny adage. Some people are taking Postinor 2 for people that their sperm is impotent, and some people are using condom for people that their womb is not functioning again. So the thing there is having a trusted partner, number one,
Okay.
using condom. If the condom by maybe somehow it gets busted, you can use Postinor 2, but it should be once a month. Also, knowing your safe period and knowing how to calculate your safe period, knowing your ovulation, knowing your safe period, and knowing the menstrual time, it will really go a long way to help you to prevent unwanted pregnancy.
Wow. That's very nice. So there is no particular drug we can take that is safer.
No, you just have to be careful. That's just the thing there. That's why condom is important.
Okay. Okay, Mr. Victor, though I've been hearing about you, so we decided to invite you for our interview. You're doing very well. Thank
Thank
you
you
very
very
much
much.
for honoring our invite.
You're
Do
welcome.
have a nice day.
Okay, thank you.
Thank you for this episode and thank you for watching us. Do well to subscribe, do well to like, do well to comment, share your thoughts, and we'll get back to you. Do have a nice day. Thank you.